Hello, friends. Do you know that there are certain areas in your face which, when gets tight and stiff, they are more likely to cause facial pain, facial spasms, and unnecessary pull. And this impacts a lot, especially to the ones who are suffering from Bell's palsy or synkinesis. So if you who are someone who is suffering from Bell's palsy or synkinesis, then in this video I'm going to share you some important facial zones or spots where you are at higher risk of developing stiffness and tightness and sometimes pain too. What are these spots and what you should do about it? We are going to discuss that in this video. So make sure to watch this video till the end. Let's begin.
So, before we start, we need to know about the facial muscles. As you can see in this image, all these muscles in this alignment that you see are the facial muscles which are controlled by your seventh cranial nerve. Each of the muscle involved in a expression that we make. Now, if you find certain spots here what is unique is these are the spots where there are two and more muscles merging or coming together. That's not all. There are some few other properties of these facial muscles. For example, property number 1 is that these facial muscles starts from a bone or else over a muscle and attaches to your skin. The second property of this facial muscle is the fact that it is controlled by two brain areas. One is your limbic system, another is your motor cortex. So whenever you will feel an expression, you will make an expression, and when you ask yourself to do a facial movement, at that time also you'll make a facial movement, right? But both of them are kind of different things. And the third unique property is that the muscles move in a different way. So here the muscles moves from insertion to origin, which means the place where it attaches to the skin, the muscle starts contracting from there and goes towards the origin. Now, this has a direct impact on how these facial muscles are pulled in different facial scenarios. So, for example, when I have to raise my eyebrows like this, my brain is sending the signal that I am supposed to raise the eyebrows. Now, what will happen is since this muscle is also connected to the muscle around your eyebrows, where one muscle pulls downward to cause this fine lines and the other muscle closes the eyes. When you will have Bell's palsy or synkinesis, and that scenario, due to facial muscle weakness, you might end up contracting the other two muscles to an extent. And when that is happening repeatedly, there is this tension spot that will develop at the junction where all of these three muscles are meeting. This happens particularly because of the different directions of the facial pull. The more the stronger the pull, the more tightness you are going to develop. Even if you have Bell's palsy or not, if you have this constant tendency of frowning due to too much of focus or too much of screen time, in that case also, when you are forcing these muscles, there are certain fibers that gets pulled here, and there are certain fibers around your eyes that gets pulled here. And the junction where these three muscles merge usually gets tight and tensed. This is not just one area on the face. Here are some more other areas which are commonly the junction point of stiffness and tightness. So this is the point area 1, where ocularis oculi, your corrugator supercilii and your frontalis muscle is involved or else is getting merged with each other. The second spot is the place where you get crow's feet or else side creases. This is the spot where your eye muscle, which is your orbicularis oculi muscle, the temporalis muscle, which is your temples, and your smile muscle, the cheek muscles ends, kind of merge with each other, causing the stiffness being developed around the cheekbone region and the eye region. This is also the place from where your jaw muscle called as masseter can pass. And that tightness further leads to stiffness in this region, giving you that crow's feet stiffness around the eyes. The next junction is at the nasolabial fold, where your nose muscle called as levator labii equuli nasi, the nasalis muscle, and your muscles which are responsible for your lift of the mouth, which is your levator labii superioris, your levator anguli oris, your zygomaticus major and minor are contracting all together, giving a pull in different directions, making this area very tensed and tight. The next area commonly getting affected is the corner of the mouth, because this is the junction where all the muscles that are responsible for your smile and the muscle that's responsible to pull your mouth muscles down are getting inserted or connected. So, whenever there is this abnormal pull happening in these directions, you will observe that the tension will develop. The next area is the neck area behind your ear, where your digastric muscle, your sternocleidomastoid muscle, and your platysma muscles, these three muscles lie. And this is the area where stiffness usually develop. And the last but not the least, the area of stiffness that develops is around your collarbone, where your platysma muscle is starting. The other muscles that do exist are your pectorals muscles, which merge and causes the stiffness being developed in this region. So, what to do about these areas? The best thing that you can do is a myofascial release technique. So, use your hands, grab it, and release this area with the help of gentle massages. Apart from facial massages, heat fermentation are very important. Having this habit of mindfully relaxing your facial muscle is extremely critical. Make sure that you limit your screen times, and if you have to use your screen for long hours, give adequate breaks so that you can work on the relaxation of these areas. There are other techniques as well that are very much focused and specific depending on which group of muscles are getting more pulled and tensed. That's where you need a specific advice from a expert physiotherapist or else a facial rehab professional. So these are the common spots. Just have a look. Make sure to at least do a simple hot water fermentation in these areas and gentle circular massages in this area just to maintain relaxation. But if you feel that's not enough and you want some more detailed help, then definitely you can reach out to us for further understanding.
So friends, these are the important facial spots that you should be aware of. Doing regular massages in these areas and applying heat fermentation, gentle dabbing techniques will help you to keep these facial areas relaxed and far mobile. Doing this is very effective and helpful in keeping your face much in harmony and symmetry. I hope that you will try them by yourself. Please make sure to take a help from a professional before coming to a conclusion whether you have any other facial issues or not, and then only start any specific exercises. On that note, I'll end this video here and I'll see you in another video. Thank you.